Right? Yeah, so something you want to talk about, we just, yeah, I've heard this week. Should be really complicated. What? Yeah.
With the HUDs, you need to tell payments to provide for them.
Cause she's sending out two for each base, right? She's sending out one for community capital, one for DC, with two different amounts. So I don't know what to do. I don't understand why. But try. Unless she's saying this was, but there's one as. If one is community capital and one is. See. Then, did you look at that 10th thing? I sent that to you. Would you, this one, passion with the agent?
Like one for my, just a bit of.
But. Oh, and here's my other question. Do you have? What's something, what's something? So,
Like a bid,
yeah.
but we don't know if all bids, but we think we do is, when we get to the city. They, okay,
You're right, so I was just thinking, looking for like 16 minutes and saying, this one, here's the price of this for
I
that.
can try to find it for them, so, yeah, let's get them out.
It's almost like an edit.
Okay, yeah.
Hey, everybody. Thanks for joining. We're going to go ahead and get started at 10:05. All right. Good morning, everybody. I'm glad to see so many folks are here. Right. Running through this show, right? Just as a couple of housekeeping items. Please make sure, right, that you stay muted throughout the presentation. One of the things that we will be doing is we have some members of the OHP team here, right? They will be taking questions, right? So if you feel like a question comes up in the chat, all right, or please put it in the chat rather, then chiming in at the slide, and then we'll address all questions at the end. Most of the time we find when we do these things, a lot of questions are asked and they're addressed in later slides. Right. Importantly, one of the things to just cover also too at baseline is that this session will be recorded, right? Following the recording of the session, right, it takes about 4 hours to process, and then we hope to have it up on DCA's YouTube channel. If not by end of day, then early this morning, right? Similarly, right, as long as you either registered for this webinar, right, via the Teams link, or alternatively, if you push forward or if you signed in through the chat, right, you will immediately after this receive all the materials that we've covered throughout this presentation, to include this deck, another copy of the RFP, and things like that, right? So without further ado, we'll go ahead and dive right in. Right, just make sure everybody's in the right place, right? So this is bringing veterans home, the system enhancements, right? This is the first and only TA session, right? My apologies, I am very much under the weather, right? So with regards to folks that are here, right, we've had a little bit of a change, right? So I'm not sure that Vince, Deputy Commissioner Damava, or will be attending, right? But then we have Esther and Dylan, right, from Damava. Myself, I'm Mike Callahan, Director of the Office of Homelessness Prevention. We have Rita Mirabelli, who's the Program Manager of the Regional Homelessness Collaboration Initiative. We have Tina McGill, right, who is the Assistant Director for Programs of the Office of Homelessness Prevention. We have Talisa Jimenez, the Governor's Fellow for the Office of Homelessness Prevention. And we also do have Jamie Schleck, right? So following that, right, the agenda of what we're going to go on today, right? So first, we're just going to do a high-level overview, right, of BVH, right? Then we will move into part 2, which is the BVH system enhancements, getting a little bit more granular about what we're looking for folks that are answering the solicitation. And then lastly, right, we'll go through our DCA SAGE training, right? For some folks, right, if you're a current grantee of our office, if you are, or you've done business with DCA at large or past, right, this may be a refresher or somewhat boring. But we really like to dive in, especially as there's a lot of new organizations that are starting to do business with our office about SAGE and some kind of the SAGE-isms that exist. Right. So for some folks on this call that have been on the other calls, right, you've seen and kind of been aware, right, with the Lieutenant Governor's announcement on Veterans Day, right, particularly what we're doing with bringing vets home, right. Importantly, with bringing vets home, we are for the first time, right, expanding out at a state level, right, the populations that we're serving for people experiencing homelessness, right. For those folks who are unfamiliar with the Big Four questions, right, anything we do here at the Department of Community Affairs like really leads with the Big Four, right. You have to be able to answer the Big Four before you do anything, and those answers kind of drive all of the follow-on decision making and conceptualization and operationalization that comes from that, right. So importantly, right, the population that we're serving through bringing vets home, right, are persons experiencing homelessness in New Jersey that meet the federal definition of homelessness, right, and so those are the ones that your traditional GPD programs or SSVF programs, HUD-VASH, right, those folks that are traditionally eligible for that. With that, we're also serving persons experiencing homelessness that meet the state statutory definition of veteran, right? For those folks who don't know, it's a little more granular, nuanced. And then importantly, right, one of the things that we're also doing, right, is we're expanding out the envelope, right? And so we're allowing service members, meaning most often reservists, but doesn't have to be, right? It could be somebody who's on active duty that for some reason couldn't get help through Army Emergency Relief or some of those situations. And also National Guard members that, while not meeting the federal or state statutory definition of veteran for homelessness services, are experiencing homelessness in the state of New Jersey. Important caveat to that, right, is that the majority of system enhancements, but also to voucher mechanisms that we're using in this effort, right, are state funded. And because they're state funded, we can get a a little more lenient and also too more expansive with how we look at eligibility and what those envelopes look like. Right. And importantly, too, one of the things throughout this effort, and I know a lot of folks have heard Vince talk about this, I've talked about this at length, but also, too, quite a few folks have talked about this, particularly the governor and the lieutenant governor, how if the expectation of this effort is that if you have worn a uniform in the state of New Jersey, whether that uniform was, 22 years in the in the New Jersey Army National Guard, and you retired as a master sergeant or sergeant major, right? Even though you didn't have any qualifying Title 10 experience, right? If you're experiencing homelessness, that that you should be entitled to to a rapid exit from that homelessness, right? So, right, importantly, right, what are the intended outcomes of the effort, right? So the first intended outcome of the BVH process is the state of New Jersey meets an effective end to veteran homelessness. And so this means that the population identified above across the entirety of the state, fewer bringing vets home eligible persons are experiencing homelessness in the state that can be routinely housed in 1 month or 30 days. Similarly, the second intended outcome, right, and you really see a lot of the thought leadership and the sector as a whole moving away from necessarily effective end or functional zero, but over to, right, that homelessness for veterans and service members are rare and brief, right? So this means, importantly, right, that we will be enhancing, not replacing, the existing ecosystem of care to more rapidly achieve housing stabilization. And importantly, to ensure that all BVH veterans have a defined and accessible pathway to permanent housing. Importantly, we will be partnering with a national level nonprofit to audit, right, what we're doing and to be able to stamp on that process and reaching that endpoint to include midpoints, right? We're in active contract negotiations, so I can't really talk about who that is. Right. Importantly, right, so who will provide the care and direct the effort, right? So the BVH effort will be led through the state's Office of Homelessness Prevention, right? So that's us. We have a dedicated data and project management team, right? Importantly, the leader of the effort for the OHP side will be Jackie Trakelow, also known as Jackie Reese. That individual I worked really well with when I was at the VMC when we did this back in 2015, right? Particularly in Philly, right? Jackie has really led the effort to maintain functional zero in the city of Philadelphia. We're really excited that she's going to be joining the OHP team. Right. Similarly, right, there's a counterpart, right, over at DeMava, which she will be working with. This is a joint interagency effort, right? And that counterpart will also have, dialed into those various service verticals that touch and attach to homelessness with regards to that department, right? Similarly, right, like we said before, right, we're not replacing systems, we're not replacing programs. So this means that we're not asking GPD programs, SSVF programs, Vets Havens, or HUD-VASH, right, to go away. We are adding to them, right? So the entire intent of this effort is to increase throughput, to increase the number of persons that can be inflowed, and most importantly, to rapidly scale and increase the number of persons that can be outflowed into permanent housing, right? To do this, right, we're going to be expanding additional BVH diversion, rapid rehousing programs, street outreach programs, emergency sheltering, and voucher programs, particularly using the SRAP and home vehicles in order to generate the surge to realize that effective end of veteran homelessness. Additionally, right, a portion of BVH funds will be leveraged to enhance the data infrastructure of the state COCs, and coordination around veterans homelessness will also really hinge around the stand-up of 6 regional coordination hubs, right? And the particular point around that is that we really need to cross jurisdictions around COC, veteran integrated service networks, and county lines, right? What we're trying to do throughout this effort, also at the state alphabet soup level, right, is working with our partners over at DOE, working with our partners over at Department of Human Services, particularly DFD, with having influence over the county welfare agencies and Board of Social Services, and also working with our partners over at DeMava, right, to assume that, right, that we have a standardized veterans homeless access system, right, and that we're also accelerating exits regardless of where that inflow happens, right? So how will people request help? Right. So importantly, one of the things of adding to the toolbox, right, are existing coordinated entry systems. If you show up to the Philadelphia ED and you're from Jersey, if you show up to the Lions or the East Orange ED, right, in DeMava VSOs and OHP's existing constellation of housing providers, right. Similarly, right, also too, if you call 211, right, and the regular kind of processing and process mapping that is currently exiting the state, right, all of those services that already have access to New Jersey HMIS or, right, the Department of Community Affairs referral form powered by SimplyGov, right, you'll be able to inflow through that, right? Similarly, community partners and members of the public, right? So one of the things that we will be standing up, right, in mid-January, right, is a web-based referral platform, particularly so the person's not affiliated with the agencies will be able to submit a referral for services through DCA's SimplyGov instance, right? Similarly, right, for the first time, right, and as many of you know, as you read the RFP, right, we're asking all of you that are thinking about putting in an application for services to provide services to execute at a minimum a letter of intent moving towards an MOU, right, with veteran service organizations. So think about your VFWs, your Jewish war vets, your American Legions, your disabled American veterans, right? And particularly as we look to fight against unsheltered homelessness with the expansion of street outreach and emergency sheltering providers, really the intent of that is that so if Private Joe Snuffy or Lance Corporal Schmuckatelli shows up to a VFW, right, and has a beer that night and then goes and tells a bartender or tells the organization meeting once they're there, hey, do you mind if I sleep in my car in the parking lot because I've got no place to go, right, that there's a direct referral mechanism for that individual, right, to go and get shelter that night, so that's not happening. Right. Similarly, right, we're standing up a self-referral instance, and that'll operate also on the web referral form powered by SimplyGov, and also to street outreach. So one of the important kind of hallmarks of services through OHP, right, is that we really kind of stand up the two pillars, right? One, accelerants towards permanent housing placements, and also to direct mobile unsheltered outreach and comprehensive and compassionate engagement principles, right? So to that end, right, we are effectively tripling, right, the number of street outreach programs that exist in the state through this effort, particularly those who are just engaging with veterans, right? And importantly, right, not only will those street outreach programs have, through that regional collaboration, be able to exit folks directly from an encampment into an emergency hotel placement or shelter, right, if that individual, right, so chooses and there's availability, right, right, there's also the expectation of, hey, we'll be able to continuously engage with folks, right, that might be extremely difficult to serve and hesitant to engage in sheltering activities. Right. So if you look at how this challenges that we overcome through this, right, one of the things that we're doing with in cooperation with our data leads are that, right, we're creating a statewide BNL or by name list, right? And we're also standing up 6 coordination hubs, and really this address challenges that we've seen throughout the system, right, as we go and kind of iterate on, all right, what is the best way to effectuate a strategic goal around homelessness across the state, given the substantial fragmentation across it, right? We've met with a lot of stakeholders on this. We are engaging pretty continuously, particularly really thanks to those folks from orgs who have already stood up from the state 16 COCs and from the county and COC BNL working group that stood up and meeting again tomorrow. Right. As we smooth out and standardize, right, the BVH portion, right, of what this looks like. Similarly, right, going over access barriers, right, the multiple points of inflow, right, really is designed to overcome and engage with, right, the historical barriers around those services, particularly coming from VFW or a American Legion or a faith-based partner, and also to expanding out street outreach like we talked about. Right. We're overcoming coverage gaps, right? There's a lot of folks that, meet the federal definition of homelessness services, but they don't necessarily meet the criteria for HUD category 1 for literal homelessness, right? So importantly, as you've seen in the RFP, right, we've gone to a category B, A, B, and C system, right? And those categories, particularly for BVH funded programs only, right? They're really a lot more expansive to include not only couch surfing, but also to include, right, living situations which are untenable and because of some service-connected injuries or some self-attestation of such, which are likely to precipitate an entrance into homelessness, right? Similarly, and one of the things that we're doing here is right, through what we've seen through the Housing Choice Voucher Program, we're standing up a dedicated team of landlord engagement staff on top of, right, the housing support staff that'll be stood up right through this. Right, one of the great things about being the state's largest public housing authority is that we have a lot of contacts for a lot of landlords, right? And there's also going to be a pretty substantial marketing effort to go and engage with those folks, right? Similar, we will be retaining an external third-party vendor for that marketing campaign, right? And also too, that'll also be co-quarterbacked by Jamie Schleck, who is the special advisor for the office for the Bringing Veterans Home initiative. Similarly, right, and lastly, and most important, right, we all know that homelessness is a game of musical chairs. We also know that the state's affordable housing legislation, A4S50, right, that was passed earlier this year, is really transforming the landscape, right, of not only right what towns have obligations to produce, right, but also too, it's a really great opportunity to leverage our housing production vehicles from the other OHP, the Office of Housing Production, led by Larissa Luciani, where we can partnering with towns to go and stand up a 4-unit National Housing Trust Fund project that has 4 project-based vouchers, and also potentially has housing services that are tied to the New Jersey Family Care 1115 waiver for tenancy sustainment services, right? And then importantly, that project right there, you would get two units of bonus credits, right? Because you've tied case management services with a CBO, but also to those 4 project-based vouchers for those 4 units. So you would eke out in that one initial production, if there's nothing else stacked on top of it, 6 units of affordable housing for a municipality, right? And in doing this, and especially looking at the most tenable population to go and effectuate, right, this production, we're really going to be encouraging and engaging in a blitz to go and make this happen. Right. So particularly as looking at folks, right, the numbers are a little bit quite higher now, right? But a key kind of benchmark to look at, right, is that our average time to housing placement across the state for all systems, right, is 112 days, right? We're going to have some substantial efforts to get that down. So the baseline goals, right, for the program is to clear the current in-program 2024 census of homeless veterans into permanent housing. Importantly, to create additional capacity in DMAVA resources and assets through phase 1 acceleration of housing placements and lease ups. And we'll talk about the phased kind of rollout approach that we're engaging right now in a little bit. Reduced average housing placement time from 60 days by end of year 1 to 30 days by end of year 2. And minimum throughput to house 50 veterans per month in year 1 and increasing to 75 per month in year 2. Right. So when we look at the current landscape that's extant, right, and kind of as we conceptualize homelessness in the state, right, even though for most homelessness is not a linear process, right, just conceptualizing it as such is sometimes a little more conducive to just grounding, right? So assuming that somebody's unsheltered on the left and they move to permanent housing on the right, the main vehicles by which, right, that housing is achieved, right, is either through SSVF, GPD, or local continuum of care, emergency solution grant, state or local emergency sheltering or emergency services dollars, and then primarily like the vehicles being SSVF rapid rehousing, HUD-VASH, or the regular housing choice vouchers, emergency housing vouchers, or project-based rental assistance, right? What we're doing, right, again, because we are not replacing, right, we are, and that is the purpose of this RFP, is we are deploying street outreach, diversion, emergency shelter, rapid rehousing, SRAP, home vouchers, and also to housing navigation, right? Importantly, all of the services that are extant and will be added to the system, right, are not self-contained, but they will also be accessible by all one team partners, right? So that means if you're a HUD-VASH case manager or you're just a regular VA social worker, right, all the way through, hey, if you're currently an SSVF case manager or running an SSVF program, and someone would be better served by a different program or be more rapidly housed through that, right, all of you will have access to right, to the BVH constellation of services and providers, right? Importantly, in that being said, right, if you are a provider or you are an agency that does not play nice with others, right, that very much does not engage in collaborations and syncs across, right, bringing vets home is not the program for you, right? It is the expectations, right, that folks are going to collaborate, that folks are going to be working together, and there will be not only a pretty steady cadence of communication, but that there will be daily updates and things like that across the entire program landscape, right? And so when we look, right, one of the things that we were doing in the service regions, and apologies, a little grainy right here, it'll be in a lot more detailed in the and what you receive later in the follow-ons, right? we tried to approximate and get as close as we could to standardizing not only census populations of current in-program veterans experiencing homelessness, but also to projecting a 20 to 25% year-over-year increase for the following year. Similarly, we were trying to drive alignment between VSN, so VA, Veteran Integrated Service Networks, right? The three VA state offices, so VA New Jersey, VA Pennsylvania, and also to VA Delaware, right, that operate in the state, and also to the state's 16 COCs. We came up and we approximated as well as we could, but one of the things with this is that as you look through awards and we talk about it, right, there's different kind of emerging trends and populations around that. Right. Okay. Right. So looking at kind of just the vouchers that we're going to be deploying for this effort, right? So importantly, right, one of the things in deploying these vouchers is that there is no waiting list, there is no extra stuff. There is very much, you use the prioritization tool, merge with clinical judgment, right? And then the case manager within that team, right, whether it be a rapid rehousing or housing supports or a street outreach case manager or somebody, or an SVF case manager, right? Those folks can direct apply to the central office, right? So you're not applying to a field office, you're applying electronically through the packets, right? Directly towards the VA, to New Jersey DCA's Public Housing Authority central office, and that those voucher requests, right, are being parsed out to the field office based upon the choice of the veteran for where they want to go and live, right? So importantly, right, this also, again, is going to require a high degree of collaboration, right, where somebody may be, staying in a bed at Vets Haven South, but, they want to, be housed up in Warren County, right? And then so particularly like working cross programs to ensure not only that the voucher opportunity is there, but also to that where the veteran feels in partnership with their case management team, right, that they're going to be particularly successful, but also to is most rapidly housed, right? That's what we're looking to achieve here. And the part of self-determination agency is really kind of playing primal with choice, right? Importantly, right, if you look at just those projections, right, any additional HUD VASH vouchers or even HUD VASH reallocations right now is a little bit up in the air with the change in federal administration, right? We are currently projecting those numbers with home TBRA vouchers and SRAP vouchers, right? These obviously will kind of move or get pushed, right, based upon how we have to do a reallocation based upon what we're seeing in the tea leaves, but also to in actuals once we receive notification from our federal partners, right? But most importantly, right, at baseline, just with the voucher programs without tapping into reserves, right, we have the capacity to house 1,139 veteran households, right? That's quite a bit, right? Similarly, one of the things in talking about what we're doing here is we are actually deploying what will be, right, for DCA at least and OHP, right, the state's lowest barrier rapid rehousing program that they've ever seen, right? That rapid rehousing program will also have an additional capacity baked in, right, with the reserve, but initially a baseline of 904 veterans, right? So when we talk about total number of veteran households, just between those two programs itself, we're talking about 2,043 veterans, right? When we look at kind of system throughput, right, and what the housing capacity is at full throttle, right, we should be able to hit once we're all up and running, probably around Q3, Q4 2025, 85 veterans housed per month, right, which is fantastic, right? Similarly, the variance to meet the functional zero goal, right, at that, right, that assumes once we're there and once we've caught up from the initial lag time, right, in deployment, right, that will be plus 10, right, or 10 more veterans housed per month than assuming the current system inflow and also modeling a 20% increase. Right. So here's a very level, right, consumer journey, right, of what that looks like. And particularly importantly, right, what with the housing navigation services deployed via BVH, right, even if folks are being served by SSVF or they're being served by HUD VASH, right, they can also leverage, right, those housing navigation services that will be stood up. One of the things with this is across all programs, right? As an applicant or standing up a program, you do not need to design your inflow, right? We will give you your inflow mechanism and process for you once you are awarded, right? As we look as far as qualifying yourself for this, we're really looking at for you to demonstrate as an applicant, right? Collaboration, understanding of a program type, but a little more granular as what is the value proposition for doing business with you in a region, and how is that being operationalized to really work towards and achieve the goal we're looking for, right? So as far as timeline, right, we're in the middle, we have almost wrapped up, right, phase one, right? We're in the middle of doing some contract amendments with our existing document assistance and supports for housing grantees from the Office of Homelessness Prevention, our team. We are midpoint. We are at midpoint in training VSOs and Demava's teams, right? We just completed our training with Vets Haven South 2 weeks ago, right? We're on the calendar. The holidays cause a little bit of time breakup and a little bit of slippage to the right, but we're on the calendar with the county VSOs and Vets Haven's North, right, to train those folks pretty soon, right? And importantly, right, as they work through that process, the folks that are in the existing census, both Vets Haven North and Vets Haven South, and also to the VSOs with anybody that are interfacing there. That'll be the first inflow into those voucher programs. Importantly, we're ahead of schedule in a lot of the phase two stuff, right? All of you know that, you're obviously responding to this opportunity. So you're here and we have deployed it, right? Our public housing authority, right, led by Elena Gaines and Aisha Law, right? They are ready, operationalized, and good to go with start to receiving housing vouchers, right? We have the statewide BNL data infrastructure primed, right? We're just in the beginning stages of stakeholdering that with our data science teams. And similarly, right, we've engaged in a pretty substantive external briefing with kind of the system change and system behavior changes that are going to come, right? Had a really great call with some of our federal partners last week. Really super supportive, right? We'll be continuing to drive briefings with other continuums, other veteran service organizations, counties, and any other stakeholders, right, that really need to be looped in for this, right? So when we look at phase three, right, that's coming out, right, of once we're out of procurement and we're into awards, right? With that, right, what's really fantastic about partnering with the MAVA is they have a fantastic, essentially community college campus, right, on Seagirt at their main training facility, right? And a lot of the trainings along this it's going to be a very much higher touch program than they're probably used to, even for our office, which is pretty high touch, right? Similarly, right, the regional and COC BNL is ingested and the ETL processes are good. The SimplyGov instance, we stand up. And then a regional daily BNL stand-ups are started and weekly statewide calls happen, right? Similarly, on January 25th, right, that's also when we will turn on, right, the inflow, right, from external rapid rehousing or SSVF or GPD programs. And to that end, right, that is all. We're going to see a pretty substantial surge, right, from that, right. The housing authority is hiring some additional teams and additional staff, right, at various regional offices to go and make this happen, and also to be supportive of that, right. In phase four, right, one of the things particular around doing this is a lot of folks know the New Jersey HMIS dashboard, right, which is a quarterly update on all things HMIS and kind of going on in the state with regards to the ecosystem. One of the things that we're going to do around that, right, is to launch a public Power BI dashboard just around the Bringing Vets Home initiative, right? That will be updated daily, right? And ensuring that not only are we demonstrating accountability, right, to our external partners and to, right, our various constituencies and stakeholders, but also too, right, that we're really demonstrating the progress and that, if you deploy no barrier and low barrier resources in a targeted collaborative fashion, that you really can achieve reach goals, right? And in doing so, right, we're also, right, we will ask executive leadership and other leaders, right, from the community, but particularly around BVH grantees, right, to have a confab, right, right at the end of Q1, beginning of Q2, and next year to kind of go over lessons learned in the first 90 days and to make program adjustments, right. Similarly, that marketing campaign, right, we expect that to be out of RFP and real formal engagement to start around that. And similarly, right, one of the hallmarks of the efforts in Philly, but also efforts elsewhere across the nation around ending veteran homelessness is really public-private partnerships, right? And so Jamie Schleck from the OHP team we'll really be leveraging and leaning into, right, getting groups like Prudential, getting groups like Amazon, getting groups like J&J, right, not only dialed in, right, but also to seeing how, right, their efforts, not only a philanthropic or corporate social responsibility side, but also to just from a manpower side, we'll be able to really land some of this, right? And so now, importantly, going into the system enhancements, right? So, as an overview, right, we're trying to achieve, right, an effective end to veteran homelessness, and this means making, right, veteran homelessness rare, brief, and non-reoccurring. Right. Similarly, right, we're creating a dedicated pipeline to permanent housing, right, and also to understanding and socializing that pipeline so that you have just as much as an equal opportunity to, achieve, right, an SRF voucher or an exit from, say, you're in a transitional program like Community Hopes or Vets Haven, right, right, into permanent housing as rapidly as possible, should you so choose, right? Similarly, the key features of what we're doing, right, comprehensive statewide approach, multi-channel access, we're standing up those 6 regional hubs, and we're integrating, not overriding the existing services, right? And so these are the regional structures. So importantly, as stated in the RFP, right, there is additional funding, right? But as we are deploying funding currently, right, there's a couple different weights that went into currently deployed funding to include current census and other items, right? There will be awards exceeding these minimums, right? So importantly to discuss and just kind of a foot tap that again, right? When you are asked or being responsive, right, to deploying a program, right, please scope it, right, as you need to operationalize it, right? Understanding and being close to the minimums, but also to, right, understanding, right, that this will be more than a one year program. But your initial budget calculations and anything you do should be for the initial first year, right, with understanding that these funds will be awarded in the first year, right? So importantly, right, program components, right? There's been a couple questions that we fielded already, right, about, okay, well, I'm a Passaic County provider, right? Does this mean that I would have to provide services for the entire of a region? Yes, right? So we're really looking for applicants of a component, right? To go of a component within a service vertical to go and take on the entirety of that region, right? Importantly, right, applicants are more than welcome to apply for the totality of the program, right? Meaning that street outreach, rapid rehousing, emergency shelter, diversion funding, housing navigation, and regional coordination could sit at one agency. But again, right, we're really trying to foster not only collaboration across sectors, but also to expand out the number of providers that are providing services to these populations, right? And so when you go and you're engaging with conversations, right, with your peer agencies, with what that looks like, right, you know what you're good at, and you also know what is a reach for you, right? Understanding those things and understanding your left and right limits and your national limitations, right? Please be responsive and understand that even if you put in an application for just say street outreach only, right? And if you put that application in for 3 of the 6 regions in the state, right? That application will be weighted against the other applications, right, within that region. But we will engage in the community building and coalescing around regional providers for that purpose, right? So you do not have to put in for all 6 elements should you choose not to, right? And so understanding street outreach, right? So the minimum funding, and again, this is the minimum funding that you should be scoping your program at, right? We're really looking for a full-time outreach coordinator and full-time outreach worker, right? That's okay. Or alternatively, right, you can come up with different FTE schedules as long as you have, right, that kind of overlap and that expectation, right? Right. Importantly, right, there are no engagement limits for this, right? And with this, right, with no engagement limits, that means that if your street outreach team has to engage with an unsheltered veteran 175 times in order to get to that magic moment into housing, well, that's as long as it takes, right? Similarly, we have the expectation of a mobile first approach, right? Anybody who tells you do street outreach behind a desk is not accurate, right? And similarly, right, all right, we're really looking for a harm reduction model, right? So harm reduction means that if you are engaging with someone experiencing unsheltered homelessness, but that household or that individual, right, say they're sleeping in a tent up in Wharton Forest, right? that you're dropping off a blanket, you're dropping off some emergency items, right? Because they've chosen not to engage with services with the intent of you are going to show up next time to go and have that conversation again around housing problem solving. Similarly, right, our programs are trauma informed. And so what that means is, right, they're realistic, but also understanding that sometimes, right, in being the face of either the government or a service provider, right, that if someone engages, right, in some hesitancy or is some aggressiveness around services, that oftentimes that is a realization of a failure or a suboptimal ending to a service episode prior, right? So really being able to have your outreach teams engage in service recovery. We're not expecting, right, drill instructors or drill sergeants or anybody else to start barking orders and all that, right? If that is your current mechanism of outreach and things like that, please do not apply. Right. Similarly, eligible costs for this: staff salaries, transportation, emergency supplies, technology, equipment, training, and PPE. Right. Importantly, right, vehicles have gotten prohibitively expensive. Right. As you see, there is guidance in the RFP. We have a preference, right, for leased vehicles. Right. If you absolutely must purchase a vehicle, please understand, right, that DCA will be the first lien holder on that vehicle and that we hold that lien on the title for a minimum of 5 years. Right. Similarly, if there's any adverse activities or otherwise or performance issues, right, and we pull that grant, right, DCA will move to recapture that capital asset. Right. With regards to performance metrics, right, our street outreach teams, it's the expectations, right, that they will be having daily updates in the New Jersey HMIS, right, 24-hour initial contact response, and then 80%. So the conversion ratio of a fully operational program, right, is around 80%, right. Rapid rehousing, right? So particularly around rapid rehousing, right? We will be giving you all the forms from everything from intake to housing stabilization plan, all the way through standardized lease riders, addendums, and things like that, right? There's no need for you to regenerate or to capture these forms, right? Some unique program features around this, right, is that income eligibility is up to 120% AMI, right? And we've done this particularly given a very emerging need, particularly around millennial veterans. So I am a millennial veteran, and we're seeing this quite a bit in our own community. Right, is that we really need to also serve working veterans and relocating folks that if say an individual, right, is facing eviction and the prevention spend is north of $47,000, right, then rapid rehousing out to a different unit is kind of the move there, right? Similarly, right, we will be using rent reasonableness, not FMR, right? And so this adds a little bit more flexibility in unit selection, but it also to market responsive pricing, right? Importantly, rent reasonableness is really going to help kind of combat a little bit. It's not going to solve for all the issues with finding a unit right now, but it does expand out the property envelope with that, right? There's available landlord incentives, soon to include signing bonuses, risk mitigation funds, and also vacancy payments. And also too, through this rapid rehousing program, you will able to cover realtor fees. We will talk a little bit about, post engagement, what those realtor fees look like, and what the limitations they're on. We are in pretty substantial conversations with the New Jersey Realtor Association, who very much want to be a part of this effort, right? And we hopefully will have a little bit more guidance, but also to participation from that entity around that, right? So when we look, right, financial assistance, right, short-term rapid rehousing would be for 0 to 3 months, medium term 4 to 12 months, right? There's also a graduated subsidy option, right? And the coverage costs for that are moving costs, security deposits, utility deposits or payments, right? When another DCA program or DHS program would not be appropriate or ineligible, right? And also basic furnishings. Similarly, the support services, right, is the expectation that a rapid rehousing case manager is going to do a housing search, connect with employment assistance, connect with benefit navigation, do some initial baseline financial coaching, work with healthcare, particularly our partners at VHA, right, if that person is VA healthcare eligible, right, and then connecting with other service providers like LS&J or Community Health Law Project for needs there. And that being said, right, there is a substantial, as many of you know on this call, right, the 1115 waiver is standing up, and part of the 1115 waiver with move-in supports, right, is security deposits are unallowable costs through that. Similarly, for tenancy sustainment services, right? Exiting case management, but say a veteran still exists where more traditionally, if you went through the HUD-VASH, right, the HUD-VASH program, right, that HUD-VASH case manager would, or a social worker would stay with that individual, right? Sometimes we see with rapid rehousing that there's not a handoff, right? Part of this is we're working across programs, particularly with the stand up of pre-tenancy services and tenancy sustainment services through the New Jersey Family Care Waiver, right? 1115 waiver, so that, right, that handoff not only happens, but say that veteran for whatever reason either chooses not to engage with the VA, or right just wants to exclude themselves from VA participation, but that those tenancy support and long-term case management services are really appropriate, right? Um, Being able to flex across systems to go and pivot over to make sure that that sustained case management happens is really going to be also be a hallmark, but particularly about the sustainment of this effort. Right. With emergency shelter, again, it's minimum funding, right? So we have the expectation that there's hotel and motel based placement, right? We're looking for maximum initial stay, right, of 14 days, right? With the 7-day placement, right, being optimal at baseline, right? We're really asking for programs, particularly if you look street outreach and the emergency shelter components really do align very well together, but there's also an argument to be made for referral systems and services, for example, like 211, also, to go after an emergency sheltering component if they so choose, right? It's just dependent really about our expectations of how you're not only going to meet the need, but how you're going to be able to deliver rapidly, right? And what we're looking for, right, with those programs are dedicated hotel liaison, transportation support. Most often this happens in the form of Uber, although particularly in partnering with our street outreach regional components, right, that could also be a mechanism by which you effectuate that exit. Some basic needs assessment, some very basic baseline safety planning, and then housing focused case management that passes off into the downstream referral partner. Right. So particularly eligible costs, right, for this component are room charges, staff time, transportation, basic necessities, emergency food, and any documentation assistance, right? We're really looking for all placements to be happening within 48 hours, right? 90% exit to housing plan, 75% length of stay within or under 14 days, and daily New Jersey HMIS updates. With diversion, right? So importantly, the diversion funding that we're deploying as a component of this program is not like our traditional OHP diversion program, right? We are providing diversion as a pot of money, right? The best place that this could sit, right, is with the emergency shelter or street outreach provider, right? This can also sit with other components, right? Should that be, your Huckleberry, right? But particularly the minimum amount of funding for this will be $80,000 for this first year, right? And we will most likely be substantially increasing this, right? So importantly, with our diversion funding, it is very much intended as shelter and homelessness diversion, right? So intent is the same day response, it's flexible financial assistance, and that there's natural support engagement with either a street outreach team or emergency shelter placement team or other. It could also sit right with BVH rapid rehousing also, right? Understanding that this can pay limitedly, right? Rental arrears, utility placements, transportation assistance, family reunification. So that means getting the veteran or the veteran household the Amtrak ticket to go take them back down to North Kakalaki where they have a cousin, and that's going to be a successful exit, right? Or conflict mediation or other engagement, right? One of the hallmark spends I always like to talk about that really works out really well with our diversion funding is buying a individual household a set of non-slip shoes, right? So that, right, a working mom could go and work at a job that could pay her $7 more an hour. And that spend right there, because she didn't have any savings, was able to successfully exit that household from homelessness or further risk of homelessness, right? And so in the end of the day, we spent $50 and it was flexible and it was a solid win, right? One of the things that we ask anyone or any agency where the diversion component sits is that there must be credit card access, right? So we have the expectation that it's not you cut a check and and the person receives services 48 to 96 hours later. It is very much same time, immediate, able to do so, right, in most cases. Importantly, right, if you do not have internal business processes set up, if you do not have the runway to do so, right, diversion may not be, right, the component for you. Right. Similarly, right, the idea is that you integrate diversion across staff, right, and that, right, it is aligned more broadly. Once you are the awarded entity, right, we will talk about how the total coordinated entry for BVH, how that screening will take place, and what that looks like. Similarly, right, we're looking for folks that go into that program, right, 70% successful diversion rate, at least a 48-hour resolution for a timeline, 90% prevention of shelter agents entry, and the cost per household targets, right? So right now we're at an average diversion spend for other two diversion programs, so both OHP diversion and IHPS, of around $1,250 per household, right? We're looking to keep that right there at that threshold, understanding that when we look at households diverted, right, we're really going to be talking about 55 to 60 households in each region with that minimum baseline funding. Right. So for housing navigation, right, we're really particularly here, right, the majority of these dollars are staff dollars, right? And so when you look inside the RFP, right, there's some pretty substantial language on our expectation for a program manager, for what a housing navigator should be doing, and for what a landlord engagement specialist should be doing, right? And the core activities of this component are going to be housing search assistance, landlord recruitment, property owner education, unit inspection coordination, lease negotiation, and move-in coordination, right? It's importantly, right, as we look at this, is, we're really looking for agencies that are applying for this to demonstrate their subject matter expertise, right, or value add in doing these services, right? Not, oh, well, we have a rapid rehousing case manager that's really good talking to landlords, so they're a natural fit, right? So if that is a growth opportunity, or if that's a pivot that works more generally towards that, that's perfect. But, we really want to make sure that there's alignment there. Right. So particularly, right, dedicated point of contact, risk mitigation phone, vacancy loss coverage, and a rapid response to landlord concerns, right? So we're looking for an average day, right, 30-day housing time, right? We're looking for the vendor for this service vertical to have at least to cultivate a minimum of 50 active landlord partners. We're looking for a 90%, right, first year unit retention rate and an 85% inspection pass rate for HQSs, right? Similarly, like we were talking about, right, there's the opportunity, right, to leverage the BVH funding to stand up a program that very much looks in alignment with pre-tenancy services that are available via New Jersey Family Care, right? And so many of you who will be attending our TA session tomorrow for that infrastructure funding, this is another mechanism not only to stand up this program and to go and do so, but also to it's another mechanism to ensure continued sustainment, right, through the first phase of the waiver, which ends of the 1115 waiver, which ends in 2028. Right. Importantly, right. So the regional coordination, right. So regional coordinators, right. We have the expectation that you will generously pay these folks if you are the applicant for this, right. The expectation is that the person who is a regional coordinator, right, this is their FTE position, right? There's no other program duties, right? Similarly, we're really looking for folks that have regional or continuum of care, case collaboration experience, but also too, right, when you say by name list, it's not the first time they understand what that is, right? We're also looking for some baseline data analytics skills, right? Nothing crazy, just able to do some pivot tables in Excel, right? Maybe a VLOOKUP or an XLOOKUP or two, but nothing else beyond that, right? Similarly, right, the core responsibilities of this position, right, are really daily by name list management for the region, stakeholder coordination, system performance monitoring, resource allocation, cross-sector partnership, but also to having that key liaison with the region's continuum of cares. Right. So as far as kind of the meeting threshold and as you're scoping and looking through this, right, there will be daily by name list huddles. There's going to be weekly team syncs, bi-weekly leadership calls, monthly peer sessions, and also quarterly in-person meetings that this person will be expected to attend, right? Really, what success looks like for this role, right, is 90% regional BVH HMIS data quality, 95% meeting attendance, 85% partner satisfaction, but also to really substantive and timely quarterly progress reports. Right. So we're talking about agencies, right? Who is eligible for these opportunities and to apply for some of these service verticals, right? Either as a component within a region or for the entirety or totality of a region, right? So we're looking for 3+ years of relevant experience, right? We're also looking for regional service coverage, right? So county programs, again, just to foot stomp this, county programs only will not be considered, right? Unless they're part of an MOU or a letter of intent for a total regional deployment, right? Um, as with every Office of Homelessness Prevention and Department of Community Affairs DHCR application, right? Your organization must sign and execute, right, a resolution that affirms housing first principles, right, and that you are housing first agency, right? You must document the person with lived experience and expertise integration within your agency, and you must be an active participant in at least one of the state's 16 continuums of care, right? Similarly, like we expect you to demonstrate that that you have familiarity and facility in working with the target population, right? Whether that be federal definition veterans, state service members, or National Guard members, right? Right. Really successful applicants to this will not be their first foray into veteran services. What or veteran homelessness. While a lot of homelessness, expands out through, if you look at that Venn diagram a little bit more broadly to all types of homelessness, and there is commonalities that run through that, right? With regards to things like a DD 214 or an NGB 22 form or things like that, right? There's an expected kind of baseline understanding just of veteran documentation thresholds, but also too some of the unique kind of cultural nuances of this subpopulation. Right. So we look at far as performance requirements with vendors that are responsive and particular awardees for this, right? We're looking for an operational start within 30 days, right? That is very aggressive, right? But we're really looking for agencies that want to lean in, are excited, and able to hire off of this, right? That being said, right, we are understanding that the hiring pools are what they are, right? By myself, right? We had two folks that we thought here were golden and ready to start at OHP, and they unfortunately both declined. So this declined the offer a little bit late, and that's okay, right? So while we want to be understanding of the current dynamics, right, of hiring, we still have the expectation, right, that you will be operational as soon as possible, right? Similarly, once you are awarded and you receive contract notification, we have the expectation that you give 24 hours to the executive board of your regional continuums of care, right? And that you are continuously participating in that body actively, right? We expect 99% data quality, right? And so this is very important, right? If your organization struggles right now with its data quality and being able to report in a timely fashion, right, that will be grounds, right, for termination of the contract as a vendor within this program, right? You will see that clause in the section C of your awarded contract, right? So please make sure that you are deftly and taking a good look at your business processes to understand as you build out and are responsive to this opportunity that you can, in fact, right, maintain the highest standard of data quality as we go in through this endeavor, right? Similarly, right, for all programs, right, 80% housing pathway within 20 days, 100% housing pathway within 30 days by end of year 2, and 80% successful service connections by year 2. Right. So if you look there in the appendix in the RFP, right, there's some required tools, the BAVH prioritization tool, the housing barriers assessment, the housing stabilization plan. Again, as we said earlier, right, the rapid rehousing and diversion components will have Office of Homelessness Prevention provided program file documents, right? So you will be getting a program in a can from a documentation standpoint, right? You're really kind of scoping out, and when you're responsive to the narrative, right, just hitting all the points that we've kind of outlined and articulated here, and understanding that some things are going to shift based upon deployment and moving through contracting, right? So timeline requirements, right? So importantly, right, the expectation for all street outreach contacts, right, is that an agency providing street outreach services is responsive via phone if an individual has a phone, right, by signal within 2 hours of that initial signal of that, right? Similarly, the expectation is between 12 and 24 hours for a face-to-face engagement upon a signal of that unsheltered homelessness, right? initial contact, apologies for the typo there. For the other component is any referral flowing through the referral matrices that are happening and notifications thereof, right? We expect everyone to be responsive, at least for initial engagement, with 24 to 48 hours, right? Similarly, assessments to take place between 48 and 70 hours, and solid housing action plans, right, to be operationalized and in process, right, between 72 and 96 hours at a minimum, right? Importantly, right, there's the requirement for either a memorandum of understanding or a letter of intent to execute a memorandum of understanding with veteran service organizations throughout the state, right? Importantly, we will also be sending a contact sheet out for additional veteran service organizations beyond these, also inclusive of these following this webinar, right? And so importantly, if you are actively soliciting, right? These, if you're actively soliciting these, right? These are the contacts for the VFW, right? We are asking that individuals execute MOUs and LOIs with the state level agency, again, the state level agency, right, of the veteran service organization, right? And that's purposive, right? We want to make sure that, right, we're not only aligning with the command structure, right, of those organizations, but that those state agencies can act as the quarterback, but also to push down, right, to their lower echelons of, not only what is going on, but what the baseline expectations are, and also to as far as what the participatory expectations are, right, for those posts, right? And so those are the ones from the VFW, right? And so Commander Charles Jackson, rather, right, for the American Legion in New Jersey, right? And then also to John Baker, right? And then for the Disabled American Veterans, DAV, right? Those are the two email addresses there. Again, you will be getting a matrix with all of these contacts to include other organizations like Jewish War Veterans and Iraq and Afghanistan Veterans of America immediately following this, right? But importantly, as I said again, right, the expectation is that you execute at a minimum an LOI with a state level organization, not a local post, right? So going into scoring criteria, right? So particularly, right, what we're really looking for is total alignment, right, with everything that we've talked about, particularly that you are clearly articulating in your application that you have the organizational capacity by which to achieve this, right? And also to not only to achieve the goals and the intent of what we're doing, right, but that any tasks, right, that have a purpose attached with them around bringing veterans home, or just more broadly collaboration around that, right, that you're really able to do so. And not only will, right, your agency's your agency's program as delivering services, not only will there be buy-in there, but they're also going to be buying at the executive and board levels, right? Importantly, right, we're also looking for really well-developed proposals, right? Please do not do cookie cutter stuff, even for existing OHP grantees, right? Also, please do not chat GPT or Claude AI your applications, right? It is very, very clearly evident when that happens, right? Happy to have AI and ML assistants go and, refine what you want, right? But part of this is, as you're responsive to this, right, there are real humans that are looking deeply to ensure alignment with the governor's intent on this, right? And so now we're moving into SAGE, right? So with SAGE, right, SAGE stands for System for Administering Grants Electronically, right? I know every webinar I kind of foot tap this, promising that one day we will roll out SAGE 2.0. Allegedly, it's happening next year, but I will believe it when I see it, right? So for those folks who continue to engage with SAGE, right, my apologies. It is a antiquated system, but importantly, right, alignment with that system really kind of drives an expeditious contracting process and also reimbursement, right? So one of the things that you really want to double check, right, are that you want to update your agency information, right? It has an expiration date, right? Also too, right, you want to look, and if anything is expiring for your agency within 7 days of submitting your application, right, or even 30 days for that matter, right, of going through contracting, you really want to make sure it's updated, right? Similarly, if there's no changes to your agency information, you really want to confirm your agency information in SAGE is up to date, right? SAGE doesn't assume that there are no changes for your organization since your last application, right? Importantly, right, one of the things that's required in Sage is that you submit a board resolution saying that your organization, right, that the leadership of your organization is supportive of your application, right? Importantly, if we receive a board application or a board resolution rather, that has a different president of the board than what is outlined in your than what is outlined in your agency information, right? That's a reason for disqualification, right? And similarly, like we talked a little bit, right? Please make sure your audit has not expired, and even like there are different thresholds for audits, right? So by audit, it could be independent cash audit. It could also be a yellow book, right? And there's some folks that may be applying that have even a lower threshold than that, right? Whatever your expectation of audit most broadly operationalized is to provide the department, right? Please make sure that that is submitted and re-upped if necessary, right? Within 10 business days before the application deadline, right? And this is important for this reason, right? If your agency information isn't updated or your audit is past due, Sage will not allow you to submit your application. And this requires a waiver at the commissioner level to override, right? So unless you're best buddies with Jacqueline, right? Or, you feel there's some extenuating or other circumstance by which, you couldn't comply with this, right? That is the only way that we can kind of get beyond that, right? Similarly, one of the things we ask for are that the appropriate staff are in the email contacts with the proper access level, right? And so once you have click submit on your application, one of the things that we are required to do because of state procurement regulations and statute are that communications have to be facilitated through DCA Sage. So this means that if only your development person has access to fiscal matters and not your CFO or not your bookkeeper or the person who's in charge for day-to-day fiscal operations, right? Some of the requests that may go through for budget modification, or more importantly for paying invoices or remuneration around FSRs, right? They're not going to be going to the right place, right? And we really need to make sure that there's alignment there. Similarly, right, if there are people that are listed on your agency that haven't been with the agency for more than 5-6 years, right, please do yourself a favor and delete them from your agency's instance, right? It's just good bookkeeping, and it also shows that you have a good deal of not only fiscal controls but also to operational controls within your agency, right? Right. So remember, right, we already kind of touched on top of this, right? Is your board member list current within DCA Sage? If your board is out of compliance or it has been inactive for a greater than 120 days, again, we are unable to execute a contract and to make reimbursement payments to include issuance of advances, right? Please verify that your vendor number is correct in New Jersey Start, right? So if you change vendors numbers in New Jersey Start, if you've gone through some M&A or a merger and acquisition activity with another nonprofit or with a different entity, and now you're utilizing a different vendor number, right? Please make sure that you have the correct New Jersey Start vendor number identified in the system. Similarly, right? We ask all of our vendors to make sure that their ACH payment information is in New Jersey Start. That's the fastest way to get you reimbursement funds. Sometimes cutting a real paper check takes between 7 and 10 business days. And when we look at the time to delivery, right, we're really looking forward to accelerate that as much as possible. Right. And so again, why this is important, right? If your vendor's number is not correct, payment will be forwarded to the address currently in the system and you may not receive it, right? The thing that you really want to check is that your New Jersey Charities registration with the Division of Consumer Affairs, right? Is that correct? And also too that the mailing address that's attached to that registration is aligned with that which is in New Jersey Start, right? Again, if your charities registration is not current, we are unable to make a payment to you if you're awarded a contract. Right. And so there's a couple of things. We're going to be saying this 5 or 7 times on here, but they're really important, right? Areas of the application that are often overlooked but crucial, right? One, the resolution. So a signed resolution, which is Schedule I, and we'll go over where that is. You can find the template, right, in Sage, right? It must be with a seal or a notary stamp, right? And that's the only acceptable resolution that's allowed. Please do not add, remove, or add language to it. And similarly, the resolution cannot be submitted as a JPEG, right? It must be either a PDF or a Word document, right? And again, DCA, the department cannot enter a contract without the resolution. Right. Another thing is we're looking for certification sheets, right? So your certification of debarment and suspensions, right? That's your Schedule G. The template is in Sage. Your certification against lobbying, that's in Schedule H. The template is in Sage, and your application cover page, and the template is in Sage. Importantly, you cannot generate the full application cover page until you have done the entirety of the application, right? So one of the things that kind of is hiccups as we go through contracting, right, or make sure that all are completed, signed, and submitted, right? And so another thing to pay attention, right? So service areas, right? So, right, the applicant must have a designated site within the service area to meet with households as needed. Okay, so what this means is, right, if you are in a region, let's go, good example, say that you are provided, you are a street outreach provider in Essex and Union County, right? If your office, if your main office that you will be operating services out of, right, for the BVH program is in Essex County, right? That is fine because you have a footprint in Essex County that is traversable to Union County, right? Um, Also, too, with the geographic distribution of office space, right, it would be really behoove providers to work together and put in collaborative applications around this, where sharing tenancy around spaces, particularly and some flex space in different organizations, would really lend well to this effort, but also to really help an application really shine. Um, Similarly, please list other sources of government funding that are germane to this effort, right? So if you are an SSVF provider or you receive GPD monies or you receive other funding either through DMAVA, for good examples like SOS Vets receives funding through DMAVA, right? Or other state and local government, or if you get some foundation money, say from Bob Woodruff or somebody else to do veteran homelessness work, right? Those are the only other sources of funding which you need to disclose. You do not need to disclose the entirety of your organization's revenue sources, right? Similarly, with the Schedule A personnel, right, the percent of hours worked is equal to the percentage of salary for the state. Again, there are multiple positions, whereas the expectation, right, that the person who is working this program, the entirety of their salary and the entirety of their committed professional time is for this program, right? For folks that are going to split operations between 5 or 6 FTEs across different components, right, that really doesn't shine well. It shine through with the level of involvement and kind of communication, expectation, and thresholds we're looking to achieve here. Similarly, the total dollars amounts listed in the personnel budget equals the staff time dollar amounts listed in the budget, right? So again, right, please ensure that all application components, project objectives, scope of services, the narrative, the agency capacity and budget are in alignment with the RFP and that they correspond with one another, right? That's again why we ask folks not to copy and paste or cut and paste, right? I can't tell you how many applications we received, right, for a 2024, right, application that is a copy and paste one of 2021 that has, all the language to include some of the years, right, referenced there, right? Right. Attention to detail is really going to drive through not only making your organization stand out, but also too that you are going to deliver on what you say you're going to deliver. Right. Similarly, all applicants will be first reviewed to determine responsiveness, and non-responsive applicants will be rejected without evaluation. And so importantly, right, as said, you have a certain number of days to cure a deficiency with your application. But that outreach that our team does to your organization, right, will be facilitated through DCA Sage. So if you're not responsive to the outreach that you receive via DCA Sage, right, and email messages that often aren't formatted in the same way, right, you will quickly exclude yourself from. It might be something as you would just as forgot a piece of paper that is easily curable, right? But if you're not responsive to the team's outreach or contracting's outreach, right, you're eliminating yourself from for future participation, right? So importantly, the state may also reject any application that is incomplete or where there are significant inconsistencies or inaccuracies, right? Um, Importantly, right, our team, the first thing they do is they do a completeness review with every single application. If you have applications, right, where for some reason the wrong page was included or a PDF wasn't uploaded correctly or something like that, right, we will reach out to you to go and address it. But if you do not address it and say, okay, it is what it is, just score it, right, that small error may in fact cost you an award, right? So if we look, right, this is what an application looks like. And when we talk about, right, the application page, view applicant information, the part that's circled, right, that's really one of the most important parts, right, of going to make sure that there's updates across the board, right? Make sure you look to see if your board members are current, right? There's 4 tabs there, right? Agency service areas, board of directors, and high risk status, right? You want to make sure that it's expanded and that everything is updated all across, right? If you need to edit your board of directors, please click the edit button, which is circled, right? And please, when updating the date, this should be their initial appointment date, right? Some organizations have people have board members that have served for 20 plus years, right? It should be the date when they started or first appointed by the board via resolution, right? 20 years ago, if that's the case, right? And so when we look about the sequencing, right, you should start with the left hand of the application first, starting with program components, then moving to service areas, then moving to program description, objectives, and then scope of services, right? And again, you want to make sure that all items align with one another, right? So with the program components, right, you want to list each program component that you're applying for separately, right? So if you are applying for, say, street outreach and emergency shelter, those should be 2 separate components, right? And so you want to use the program name, not the agency providing service. A good example is this, for example, a Union County Rural and Suburban Outreach Program, right? If you need to edit or delete a program component, but have already added budget money to the component, importantly, you'll have to go back to the budget, zero that out prior to you editing or deleting their program component. And again, please only list services allowable in the RFP as articulated. If you have a question, please reach out to our team, right? So service areas, right? Make sure that if you intend to have a program area that is in more than one specific area, not entire county, indicate the service area. You may have more than one service area, right? There's also a statewide right button, so you can also select statewide, and that is also applicable for the service area, right? So program description, right? This should always start with a preposition and a lowercase 2 or 4, right? Importantly, a lot of what goes into the contract generation is directly exported from Sage, right? And so there's certain formatting issues and things like that if you're not, right? So make sure in program description, you're only using one sentence, right? And the sentence is taken from the application and converted into the award letter, right? Also, to use person first language, such as vulnerable individual, person experiencing homelessness, unhoused, etc. Right. So project objectives, right? So the project objectives, you will be adding this to that. You should take them directly from the RFP and get a little more granular as you kind of talk about your specific brand, right? And then with scope of services, right? Please be as expansive and explicit as possible, right? Even though the person on the review committee, on the joint review committee from the Department of Military and Veteran Affairs and the Department of Community Affairs do have experience in homelessness and oftentimes deep experience in homelessness and housing, right? Do not assume, right, that your review team knows what your program will look like. So this means is that you want to spell out acronyms the first time, put them in parentheses, and then use them thereafter, right? Just good writing habits that really put forth things, right? One of the things that we're also talking about is that you are character limited in all of these response categories, right? If you wish to provide more information in a more expansive document, right, there is a place for you to upload that, and you are more than welcome to do so, right? And so after you completed all the left side of the application, you want to start the right side of the application, right? Importantly, part of that is for many of you, you see statement of mayor or county official, right? There is one organization type which is required, right, to have a mayor or county official on their board, and that elected member must consent and concur to the application also. If that is not the case, right, and you are not that organization type, please put NA, right, all the way down and then click submit in order to meet that requirement, right? So the process sequentially, right, should look like application statement forms, program information, application budget information, certification sheets, and budget overview, right? And so the forms on the right-hand side, right? So application statement forms, board president, right? So this is what the board president screen looks like when you pull it up, right? And so it's click, going and filling in all the requisite information there, right? This will and then after you've put it in, right, and you've saved it, and then you click view PDF, and it will generate a PDF for that board president to then go and execute, right? Signaling, right, the support of the grant application, right? If you are not, as I just said, if you are not the organizational or CBO type that requires a mayor or an elected county official to be on your board, please put NA for all of the information requested for that subtype, right? And going to project information forms, right? So this is a standard stagism, providing an estimate of the number of people your program will serve, right? So you just go ahead and ballpark the number of people you have the expectation of serving, right? It is not a number we hold you to. It is just a stagism that has existed for quite a long time, right? Similarly, the needs which illustrate the reason for the project, right? We know deeply, right, why veteran homelessness exists and the cause, not only the causes thereof, right, but the reason why it's both a moral and policy imperative that is resolved, right? You don't need to necessarily articulate those, but particularly talking about the reason and adding further context to those statements is really going to be important as you kind of give us the value proposition for your agency, right? And that leads into your agency's capacity to successfully execute the project. So importantly, a history of returns is not always indicative of future performance, right? And so giving us a hierarchy of how fantastic your agency is great, but we really want to know, right, what you're going to be doing moving forward, right? And how this project and its alignment is also aligned with the strategic operationalization and vision of your organization as it moves into the next couple of years, right? And again, you are character limited in each of these, right? So 5,000 characters. I will foot stomp where you can add in additional narrative to include any other additional parts of the application should you have to upload them, right? So then you move on to Schedule A, right? So again, right, you want to make sure that if it's a person to be hired, right, the name of employee is to be hired, right? Also, too, instead of a resume, you are submitting a job description. So that's important, right? And again, percentage of staff time on this grant must be equal to the percentage of salary requested, right? Also, to consultants, right? So for some folks may engage with a consultant for this purpose. An allowable partial cost for this for back of house functions, or is your audit, right, or your general counsel for review, things like that. And this is where you should ensure that they're there. Similarly, if you engage with an outside HR firm or an outside IT firm, and as a consultancy basis or a contract basis to provide services to your organization, you want to make sure that they're listed here. Similarly, right, other sources of funding. So we talked about this, right? The funding should be really germane to veteran homelessness or veteran housing, right? So you do not have to list that you receive SSH money from Union County or as a pass through from DFD, right? Unless it's totally focused on serving veterans, right? But you should list if you're an SSVF recipient from the VA, if you're receiving street outreach funding or other homelessness funding through DMAVA, things of that nature. Right. And then there's the certification sheets, right? So the certification sheets, this generates your Schedule F, right? And so please indicate on which radio button, right, which is germane to your position, right? And for non-governmental agencies, again, if your agency is new to OHP, you will be required to upload your agency's 2 prior audits, right? Scanned as one document to be responsive to number 6 and click yes, right? And you want to make sure that your board listing is correct and up to date when you certify number 7. Right. The attachment page, right? So if you go and see those green links, right, that is where you download the template for each one of these, right? And then it's a place to upload right there, right? So make sure, right, with your IRS determination letter, right, that you go and you upload it in the box as responded there, right? Similarly, the RFP asks for quite a few documents and other things, right, with no designated upload links, right? So importantly, anything from a process map all the way through listings and partnerships and things like that, they should all be collapsed into one PDF, right? And so if you look, third-party agreements is the place where that should be uploaded, right? So each one of these Dropbox fields has a maximum of 20 megabytes, right? And so please use reduced size PDFs, right? If for whatever reason you cannot collapse and ensure that everything fits into these 2 uploads, right, we will provide you through MoveIt, which is the state secure Dropbox, a Dropbox by which you can be responsive and upload our documents, which will then be incorporated into your application. But that is only an option if and only if, right, that these 2 Dropboxes, right, are filled. Right. Importantly, right, your Form 990, right? And so every NGO or CBO, right, must provide the most recently filed 990, whether that's your regular 990, a 990 EZ, or 990 November, right? Similarly with the resolution, right? Please, that is your Schedule I, please click on it, right? And it'll generate it with the corresponding details, right? The resolution it cannot be substituted, right? This is what the resolution looks like, right? It's pretty standard boilerplate stuff, right? And importantly, right? So executing resolutions, right? You can sign the usual way, right? With wet pen, or you can also use AutoPen or Adobe Signature or electronic signature if you have a PIV or CAC card type system, right? Notary with regards to requirements for notarizing, right? You don't need to have one if the board secretary or an attorney on your board can sign, right? And again, we cannot enter a contract without a signed and submitted DCA resolution uploaded into Sage, right? Last part is the budget overview, right? And so each budget, right, each budget line is responsive, right, to a component line that you list, right? Similarly, if you look at this message that's on right there, the application budget structure has not been properly set up, or there are not any application project components, right? This is because you received this error because you did the budget prior to adding the component, right? So please make sure that you go back to the left-hand side of the application and add the component prior to adding the budget, right? Again, administration costs may be no more than 10%, right? And please do not bake in administrative costs into program stuff, right? If someone is a supervisor of someone acting within the program, right? If that is a program task, right, as kind of as delineated within the RFP, please put it to program. But if it's more broad agency level supervision or executive time, that should be an administrative cost, right? And again, budget items are pre-populated based upon what you entered under components. We very much appreciate granular, expansive budgets versus nebulous, amorphous budget lines that have everything and anything contained within them, right? We do try to keep a high degree of accountability, right, of the public funds. And so your adherence to this is very much appreciated, right? And so understanding that, right, salaries allocated in personnel sections must equal the percent of funding under administration costs, particularly. If you're saying 5% of your executive director salary is going to go towards that, then that 5% has to be tapped to admin, right? Similarly, please itemize each budget expense. And again, the state may reject any application that is incomplete or there's significant inconsistencies or inaccuracies, right? And so lastly, the last scrub you want to do, right, is parallelism. Do your components, objectives, and budget all coincide and align with one another and the RFP? Is it easy to identify each to its counterparts? Are your objectives and scope of services a cohesive narrative that is applicable to this opportunity? And again, we're not looking for a historical summary or name dropping saying that, hey, I know Senator Kim and he thinks we have the greatest agency in the world, right? We're looking for a demonstration of the applicant's capacity to undergo the intent and the spirit of the RFP, right? Similarly, is your budget within the minimum guidance stated in the RFP? Again, it's okay if it goes beyond that, right? But it has to meet the minimum thresholds, right? And again, the state may reject any application for missing or incomplete parts of your application. So contractual requirements, right? We require insurance, we require fidelity bonding, which is the amount of your advance, right? We require an annual audit, right? Your initial advance is 35%. Importantly, to ensure that our partners do not have to have a large cash float, right? We will be doing multiple iterations of advances. So you will be receiving funding both through the advance process and the FSR process, right? And FSRs must be uploaded a minimum of quarterly, right? So also too, similarly, right, any FSR, so FSR stands for Financial Status Report, and narrative data must be current and coincide with what is in awards, HMIS, or Middlesex's HMIS system, right? Importantly, no reimbursements will be issued until all are current and mirror one another, right? Quarterly reporting is based on the state fiscal year, so that's July 1 through June 30th, regardless of when the contract begins, and the reporting periods are pretty standard there. All right, so items to note as we wrap up and move towards questions here. If your application is returned for modifications, please place a comment in the section once you have completed the modification within DCA Sage to signal to the review team that it is that you have been responsive to that modification. Also, please remember to click the resubmit button, right, if your application is requested for modification. Right. Again, the due date for this is the 20th of 2024, right in the holiday season. So yay. Right. And then the handouts that we will be providing immediately after this, right, you'll get another section of the RFP, you'll get this training, and you will also get a transcript from this. right? So understanding that we're a little short on time with two questions, or for questions for 2 minutes, right? I'm going to go ahead and stop sharing, and then we will go ahead and I'll hand it over to Rita to go ahead and lead with the questions that were in the chat.
Hey, Mike, I think Talisa was taking note of all the questions. So if it's okay with
Oh,
you,
yeah, great.
she's going to go
Yeah,
ahead.
sure.
Thanks. Thank you.
Got you, Rita. Okay, so one of the first questions we got was from Elise Bryant. She asked, are these referrals taking veterans from other counties? The issues are agencies are not accepting referrals for veterans if they do not live in their servicing counties. Also, there is a need for outreach teams reaching out to the client veteran at a safe location. Sometimes the client/vet does not trust because of disabilities. Trust has to be gained.
All right. So importantly, I think we covered that with a regionalization, right? And through that process and the expectation, right? So if the services provided are being facilitated through a BVH provider, the expectation is that it's a regional service plan, not limited by county there, right? That being said, right, if an individual is engaged with whatever county system for certain services, right, working through that with the BVH provider to see which seeks precedence are from that, is going to be important there.
She also asked, additionally, landlords may not accept a voucher. The problem is across population/cultures in New Jersey. She also says, then there's existing buildings that could be renovated. The trust within this population can be gained when some vets are housed together
Yeah,
with supportive services.
Yeah, it's Talisa. I think we dovetailed that. So I think we can kind of move on. There's
Okay.
also. Yep.
No, I'm sorry, go on. From Diana Pell, is there a space within the 6 core elements for an organization to provide trauma-informed individual and group mental health counseling for sheltered homeless? What about services for women veterans who have been victims of sexual violence and mental health care as well?
Right. So these, while you can add in those adjunctive services and collateral services to that, right, through this specific funding opportunity, there's not the cost center for those services.
Matt Isaac asked, do applicants need support letters from all COCs in the region in which they are applying?
So Matt, importantly, right, we're just asking for a good faith effort around that, right? If for whatever reason, right, a COC is not responsive, or there was a ships passing in the night type situation, right? Just please send in applications. Please send in kind of collateral documents that testify to that fact.
Okay. And from Kristen Odell, if your agency has not participated in the pit count but are willing to going forward, if that's acceptable?
Sure. So I mean, you can put it in an application, but part of this is we are going to want to see a pretty substantive reason as to why there wasn't pit participation prior.
And also asking, oh, she already answered this one. From Nadine Moran, this is a 2-year initiative. In year 3, what happens to the veterans that are newly displaced from housing? Do these services continue?
Right. So important. These are some surge capacity stuff, right? We're going to talk a little bit more broadly into year 2 of this about what some of these additional system enhancements look like moving forward. It's impossible at this time with the gubernatorial race happening next year for us to kind of talk about administration priorities, right, moving past year 2.
And from Christina Jackie, similar to veteran programs LOI, do we need LOI/MOU plan for landlords prior to award as well?
Say the last part again, Talisa. I didn't catch that.
Do we need LOI/MOU plan for landlords prior to getting their award as well?
No, that's not necessary.
And then from Bridget DeFiccio, in light of the following federal guidance change, which she mentioned is the OMB guidance for grants and agreement, is there flexibility on the 10% maximum administrative costs?
Yeah, so importantly, these are state funds, right? With the exception of the home TBRA vouchers, these are state special purpose funds. So that threshold is department policy. And so there's not going to be a waiver entertained by.
Also from her asking, would you repeat what is necessary for the fidelity bond?
Right. So importantly, your fidelity bond will be 35% of your total award, right? So you should contact your insurance provider, right? And ask them to reissue a new binder for you around that. Just for the pricing, it's a nominal fee whatsoever. But unfortunately, we've had to engage in that bonding to recapture some advances from some grantees. So.
And from Luis de Lucia, if an agency is applying for all 6 components, can they submit one program budget for all 6 components for a particular region?
Yes, so I think we talked about that. You can apply for the totality.
Okay, and Cody, regarding billing, are the funds for service reimbursed as a drop-down fund or by applying for reimbursement and waiting?
All right, so importantly, Cody, right? We try to use both advances and reimbursement billing, right? So whichever works out best for our partners, right? So some folks, right, it's advance, FSR comes in for reimbursement. Once the cash on hand is expended, give a second advance. So there's a little bit more runway on that, and then FSR advance and going on that cycle.
And then from Shoban, is there a minimum number of clients that must be served each quarter for an entire of 12 months?
Right. So no, we're not setting broad-based minimums at this time.
Okay, and then from Lewis again, could you share a template to provide guidance for a mandatory LOI with the state level organization?
Yes, we will provide a example document immediately following as part of the right, as part of the attachments to the email that follows this.
That's it for questions right now.
All right, great. Well, seeing that we're 5 minutes over, right? I know some folks are processing people, right? They very much like wants to follow up and engage that way, right? Please reach out to the principals on this, right? If you have questions, right? Being myself, Rita, or Talisa, right? Also, please feel free to send questions to Tina McGill or Anthony Cassetta. But hey, thanks. I know we're 5 minutes after time, so just want to be appreciative of that. Hey, thanks for your engagement and really looking forward to partnering with a lot of you for this effort. All right, take care, everybody.